Hey guys, is it really sad? I look forward to giving our cat an injection every Friday. I miss clinicals. Okay, so this is a review on epitaxis or nosebleeds. So, with nosebleeds, this is from chapter 29. They can be caused by trauma, hypertension, leukemia, inflammation, tumors, low humidity, nose blowing, nose picking, chronic cocaine use, and nasogastric suctioning. So I'm sure we're all familiar with nosebleeds, but what I want to really go over are the different kinds. So we've got anterior and posterior. The anterior ones are going to be less serious and generally, and what we want to do is we want to have our patient lean forward and keep them upright. I think the general public tends to put their head back, and like, we don't want them to do that because we want to keep them from aspirating the blood, and also we want to keep the blood out of their stomach. So we want to reassure them, calm them down, apply direct lateral pressure with a cold pack for at least 10 minutes. And then we can, if it's still bleeding, we can do nasal packing, just loosely pack it with gauze or nasal tampons, whatever the case may be. And then they should not blow their nose for 24 hours afterwards. And then if the bleeding occurs frequently, then they should check it out with their doctor. If it's a chronic problem, then they can have surgery to have it cauterized with electric or silver nitrate. So if it is a posterior nosebleed, that is a medical emergency because it's so far back, it's hard to access, and we don't know how much they're bleeding out. So just remember, if it's in the back, we can't see it, and we have a hard time getting to it. So the treatment for that is going to be posterior packing, an epitaxis catheter. There's a picture in our book of someone that has one. Gel tampons, and then they'll usually, if they have the catheter, be in for 1 to 3 days, and then we want to observe them for respiratory distress. And apparently the treatment for the posterior nosebleeds is pretty uncomfortable, so we want to always assess their comfort too. And then if, for example, they are on opioids from facial trauma, and they are not all there, we want to assess their gag reflex, cough reflex hourly, just because of their risk for an occlusion if something gets dislodged. So just make sure they're okay. And then if they need more treatment, if it keeps bleeding, the posterior one, they can also cauterize that or ligate it or do an embolization technique on it. Once our patients are not bleeding anymore, we've released them, discharged them, then we want to make sure that they're educated on the fact that they should avoid blowing their nose for 24 hours, avoid any heavy lifting. We also should avoid aspirin and NSAIDs, anything that'll thin their blood. And then in their home, they can increase the humidity, and they can also try saline nasal sprays. So it's a couple things that they can do. And then that should be pretty good. Nosebleeds in a nutshell. There's also a chart on 29-5, so check that out.